And we are here having held our first Inter-Governmental COVID response committee meeting, which we co-share with the County Commissioner of Nyeri, Mr. Lyford Kibaara. And behind us, you can see the other members who are able to attend the meeting. And we would want to give a joint statement as a guide to the deliberations and also to the way forward in as far as matters COVID are concerned. Now, as of 30th March 2021, the County of Nyeri had recorded 1,493 cases of COVID-19 from an estimated 5,485 samples. Two-thirds of the COVID cases are from the Nyeri Central Sub-County, which has continuously recorded the highest burden since the onset. 58 COVID-19 deaths have been reported since the beginning of the outbreak. In the last 3 weeks, the county has witnessed an increased number of COVID-19 infections, coupled with a significant increase in patients presenting with mild to severe disease. This is largely attributable to the recent laxity in the adherence to the prescribed protocols and the public health measures. It is in this regard that the county County Inter-Governmental COVID-19 Emergency Committee meeting held today resolved to observe the following measures in order to mitigate the spread of COVID-19 disease. These are further to the measures that we had given about a week ago. Number one, the County of Nyeri will adhere and comply to all the COVID-19 directives and guidelines by His Excellency the President, Uhuru Muigai Kenyatta. All the stakeholders conducting the annual rites of passage to adhere to the guidelines as issued by the County Department of Health. And on this matter, we would want to caution all those that are participating in these initiation ceremonies to liaise with our County Director of Health, and to ensure that they get clearance for the areas and the spaces that will be using, so that the department is able to concur and confirm that protocols have been followed as expected. Number two, the county security team, working with the county enforcement team, shall ensure that all the COVID-19 directives and guidelines are observed. And not only that, they shall be enforced. It is important that the people of Nyeri know that there shall be strict enforcement towards these directives and the guidelines. And number three, all food handlers will be retested and certified COVID-19 free. And in this regard, we have asked the county director and his team to ensure that there is surveillance going within the county, key among them the major towns, to ensure that these protocols are followed, and that there is temperature measuring at the entries, there are hand washing stations, and that also the spacing in the hotels are as expected. Number four, all healthcare workers, teachers, uniformed officers, and persons aged 58 years and above to visit our COVID-19 vaccination centers, which are 11 in number, led by our CRH, Moiga, Mukuroine, Karatina, Odaya level 4 and level 6. We also have Mount Kenya. All those are areas that they can visit to get their COVID vaccine.
Any visitor or anybody who is in this county should abide by all protocols, should be having a mask worn correctly. At the same time, shouldn't be sanitizing or hand washing, and again, keeping distance. We had noted earlier before, I think out of the way the figure had started coming down, people had relaxed. But this time, we are saying we need to bring those numbers down by following those protocols. The county security team and the inspectorate, we've left them to enforce all the protocols that are there. It was very clear from His Excellency the President that we should not have any political meetings. in any gathering, we should not have, if it is a ceremony like a burial ceremony, not more than 50, and these should be family members. In church, we should not have more than a third of the space in the church. And again, we are saying for the ceremony, because we expect after the exams that our students will go to Form 1 and there is a rite of passage. Let the organizations that undertake that process being guided by the MOH, but the number in every center should not exceed 30 people. So we don't want to have a lot of questions over that, and I expect that every person will have to follow the guidelines, and at the same time ask our people to be very careful, because we cannot police everybody up to where you are. So we want you to take by personal responsibility, take personal care,